This Focus on Health segment is brought to you by Aurora Healthcare.
Today we're at the Aurora Health Center on Doctor's Court, and we're talking about addiction medicine with Dr. Eric Smiltneek. Eric, thank you so much for joining us today. What is addiction medicine?
So addiction medicine is a relatively new subspecialty in medicine. You have to be board certified in another specialty, whether it be family medicine, internal medicine, pain management, ER, and then you do some additional training to learn a little bit about addiction and how addiction works, how it works as a illness or a brain disease, and what some of the medications that we use that can be helpful to move people from an addicted state to a state of recovery.
I noticed you mentioned the word disease. Is addiction a chronic disease?
Addiction is a chronic disease. And that's been something that has really, the medical profession has been working on probably for the last 50 years when the AMA initially designated addiction as a chronic disease. Now, a lot of folks are now seeing addiction less as kind of a criminal offense or a moral failing and more as a disease process that people's brains are sick and that we need to help to do some treatments to work on moving their brains into a state that's a little bit more stable. I find it to be like some of the other chronic diseases that people know, things like diabetes or heart failure, where there is definitely a lifestyle component to the illness, that if you don't watch your diet and you don't live right, it's harder to control these illnesses, but also that there is an important role for medication and for some professional therapy as well.
And what are some effective treatment options for this?
So some effective treatment options for addiction there are a number of different medicines that are available. Some of them are relatively commonly known. So for nicotine addiction, there is the nicotine patch, or there's nicotine gums or lozenges. Those are relatively commonly known. For some other illnesses, such as opiate addiction, there's some less commonly known medical therapies that can be set up. One of them is called buprenorphine therapy. That's also commonly known as Suboxone. What this is it's an opiate replacement therapy. That means it's replacing some of the properties of the drugs that people use with a more sustained release, safer medication. There also is another medicine called naltrexone, or that goes by the trade name of Vivitrol, which is a once monthly injection medicine that really blocks the effects of opiates on the system. Also help, both the buprenorphine and the naltrexone both help with opiate cravings. So those are a couple meds that we use in the opiate realm. There are some other meds that we also use for alcoholism or alcohol use disorders that are very helpful in cutting down the craving to use and also some of the effects of use if people were to use.
So you listed a lot of different medications. Why are these medications useful for folks in recovery?
So what we basically see is that there are really two components of addiction. One of the components of addiction is that people's brains don't really work right. They make bad choices. So part of addiction therapy is really working on things like, and this is often worked on 12 steps or worked on with counselors, is how do you train your brain to make better choices? But there is also another portion of the brain that really can be defective in addictions, which is impulse control. And it's very hard for therapists or peer support folks to really work on folks' impulses. That really where the medications really fit in is reducing people's impulses to do things that they otherwise know they shouldn't be doing.
So how can an individual help someone in recovery, that family member, that friend, that coworker?
So how folks can help is really to basically tell people, hey, I understand that this isn't just that you're a bad person or that you're making bad decisions, that you actually have an illness. And like any illness, instead of just sort of sitting there and hoping that it goes away, to really seek treatment. So point people to, hey, these are AA, RNA meetings, or these are recovery clubs, but also knowing that there is a specialty in medicine called addiction medicine, where that's really is our sole purpose, is to help and to be there. So so kind of talking to people with their loved ones instead of sort of shaming them or doing stuff and saying, hey, you know, I think you really need some help, and I heard about this addiction medicine program. We have a number through the Aurora Clinic. We have a number of addiction medicine physicians in our group, which is nice because there's not a lot of addiction medicine physicians out there. That we have those folks that are available, and that's something that people can use.
And not probably an always easy topic to discuss with a family member or friend, perhaps.
Life is messy, and that's okay. So to basically say, hey, you know, things are kind of messed up here, and it's okay that to realize that, hey, we're not perfect. This isn't the perfect world, but there is some help that's available for you. All right. Well, thank you so much. It's been nice talking with you.
Appreciate it, Eric. Thank you so much.
Very good.
If you or a family member are experiencing issues with addiction, or would just like some more information on the topic, feel free to reach out to Dr. Eric at 303-8700. I'm Dean Leisgang. Thank you so much for joining us. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.